Hi guys, Dr. Miriam from Healing House in Scottsdale. I just want to show you how to do the semaglutide injection. So we're launching semaglutide and the tirzepatide. They're both done the same way. So to start, I have an alcohol pad, but if you don't happen to have this, just take a cotton ball and some isopropyl alcohol, like the 70% that most grocery stores carry. And before you pull up any medication, you always want to clean the surface. And what I'll say is when your semaglutide gets to you, if you don't see this rubber stopper, then you have to pull off that piece, like this colored piece. You don't want to go through that. Sometimes I use, just use something to kind of get underneath it. Sometimes I use something like an envelope opener. A blunt knife would just kind of get under there and pop that up. So just make sure you're seeing this rubber stopper. You're going to clean the stopper. You can save the pad to use on your skin too. And so basically, when you do your injection, it's this really small needle initially, especially when you're starting your doses, where if you see here, it says 5, 10, 15, 20, 25, and 30. These are the units that you're going to actually pull up for the semaglutide. And so the way we do it is, if you can see here, I'm going to move the lever down and up, and you can see this black part of the syringe that is going to measure where your medication's going. So 10 units here, 5 units here. So you're just going to go based on how many you're doing. Most people to start, we're going to start at the 5-unit dose. So you have cleaned your top. We're going to take this off. You're going to leave the air for whatever you're doing. So if I'm using 5 units, I'm going to leave air there. If I do 10, I'm going to leave air here. And we're going to push that air into the bottle. So we're going to start with 5 units. I'm going to grab my bottle. You can leave it on the counter surface initially. Take your syringe, go straight into the middle, and then push the air down, okay? Turn the whole bottle over, and then pull out the medication. I like to actually pull past where I'm going, and then just push it back in. The semaglutide is not going to be colored like this one is, but I use this just so you can see what we're doing. It's going to be clear, and so might be initially a little bit more challenging to see where you're going, but if you have any questions, you can always call our office and ask. So I've gotten to the 5 units. Pull it out. If you see, there's the tiniest little bubble. You can just push it to the top. That bubble is not going to do anything. So if you can't get it up, you can't get it out, it's totally fine. So what I want to do, now you're ready to go, the medication's at 5 units, and now we're going to show you how to do the injection.